Okay, do you want to take a look now?
Yes, I'm excited.
Right there, can you see that with my hand there? Okay, that one was oily.
This program examines dermatological conditions and the procedures involved with treating them. Due to the graphic nature, viewer discretion is advised.
Okay, so you shouldn't feel anything other than us touching you, okay?
Okay.
We have a lovely man here, Kenny, who has Gardner's syndrome. This is a congenital condition that can create a lot of bumps on the body and within the body. I'm gonna try to address his back first. It's going to be a very daunting task, but the most important task is just calming his nerves.
Make sure I'm not hurting you at all. I'm not gonna torture you in any way. My voice is very relaxing. The only person that feels it grates is my husband.
I'm using my best calming tactics with Kenny. We have a lot of work ahead of us because in Gardner's syndrome, you can have a lot of different kinds of growth. So Kenny's back could really be filled with a lot of different surprises, and I don't like surprises.
Okay, we know we have cysts here. So just for us here, Christy, there's obviously some fluid in here. Get some gauze out here, okay? Make a little bit of a wet mess. Like mashed potatoes. Actually, you know what? It kind of looks like German chocolate cake frosting.
I was thinking like
the middle
lemon
of it.
frosting, like a lemon curd or something.
Yeah, like well, you know how like German chocolate cake has that layer that has that kind of,
Yes.
like coconut or something in there?
It's something like that, yeah.
So far, so good. Kenny's first bump is indeed an epidermoid cyst, and the contents look a lot like grits with a little sprinkling of a split pea soup.
Okay, let me look at those. You know what? I think there's another cyst right there. Like lift it up there and then push it. Yeah, you see that? How you feel like two of them right there? Let me feel that again. There's definitely one right here, right where my fingers. Yeah, I'm seeing a bunch of other cysts. They're all butted up against this sac wall. It's like you have like little landmines under there. Landmines of cysts, I'm trying to get around them.
I'm trying to remove the entire sac of this cyst, and it's really kind of stuck up against other bumps that I feel under there. So I feel that there's a bunch of other cysts under there, really like these sort of landmines. I'm going to need to try not to rupture any of the other sacs, because if I do, that means that I need to chase that entire sac, and I don't want to leave a portion of a sac just under there. That would extend the scar line. There's more risk of an infection. This could be a lot of trouble.
Let me start moving on this, otherwise we'll be here all day.
So are they underneath it then?
Right, underneath it.
And around it too, like surrounding.
Yeah, it's like all around it. I'm like going between cysts.
Yeah.
It is, it's like a minefield here. How am I gonna get this off? I should have started with your forehead. I think those would have been easier, actually.
Yeah.
This is gonna take me a little bit. I'm so sorry.
You're fine. I don't have any, hot dates tonight or anything, so I'll be good.
Kenny's being a real trooper here. I mean, this is very time-consuming. I've got to be really detail-oriented. This is like being a minesweeper. You don't want a minesweeper that is really sloppy and just goes trudging through the land. You want them to, every step that they take, and think about what the consequences are. And that's exactly what I'm doing here. I'm trying to intricately and very precisely remove the sac wall with a landmine of cysts around me.
Sorry, that's numbing. You okay?
Yeah.
Every time I go in one place, I'm gonna put more numbing there.
I'll never complain about numbing.
There is such thing as over-numbing, though. We can put unsafe levels of numbing.
I'm using a lot of numbing, and that is another issue that I have to consider too. If you use too much numbing, that is too high a level, it can really actually affect your heart.
Yeah, I'm sorry.
No, they're fine.
We're like at the bottom of it, right, Christy? Mm-hmm. Now it's just attached by a little strand. Come on, Sandra, let's do this. You got it.
Got it?
That was probably one of the more complicated cysts that I've had to remove because it was surrounded by the guardians of the cyst.
So what are you thinking? We're gonna be able to do anything else?
I mean, I'm hoping that we tackled the most complicated first, but that took us longer than I expected, and we can't do all of them in one day. The numbing, that's too much numbing in one 24-hour period.
So Dr. Lee, what's the plan? What do you think we're gonna do?
So I think that we're gonna have him come back.
I think it's best that I stop here. I feel pretty confident that I've gotten all the cyst wall contents out and I haven't disrupted any of the other cysts in the area. And I want to see how he tolerates this.
This is called the chalazion clamp. It's actually for the eye. It's like a barbaric device if you think about that. But what we can do is we can put that area right between here and kind of tighten it so that it won't want to ooze so much. But I'm just gonna grab that area.
I'm here with Angelica, who has a pyogenic granuloma. I'm going to use a device called the chalazion clamp. And this really allows me to grab that slippery lip, but also puts pressure on the edges so that it won't bleed as profusely.
Oh, I'm so serious in here now. Great. Just put a little light tab on there.
I've gotten most of the growth off, and now I'm going to remove the chalazion clamp so I can really see how the lips look in a natural position.
You guys okay? Are you okay? Hubby?
I'm doing okay.
You sure?
Yeah, I turned away a little bit. We're okay.
Oh, goodness. Okay, now you're gonna hear a little buzzing noise. Make sure you don't feel anything. You okay?
I'm using my cautery to seal those little superficial blood vessels. If this was actually involving the skin of the lip, I probably would stitch at least part of it up. But because this only involves her mucous membrane, we do not need to stitch this up. Mucous membranes heal really quickly, and so that is really the best option here.
This will cauterize the blood vessels so it won't ooze, but also potentially if there's any more of the cells that could grow, we're gonna make sure they don't come back. Can you see that? It looks pretty normal now, huh?
Yeah.
The lip? The contour in the lip looks really good.
The lip is gonna take a little while to heal, but I do think with a little bit of time, it's going to heal really great, and Angelica's gonna be really happy.
It's still a little swollen, and it's like a little charred a little bit on the center, okay?
Oh, it's gone. I'm looking in the mirror, and I can't believe it's off my lip. I don't have to hide anymore. I don't have to worry about people saying something. It's finally over.
And here's your little friend. Right there.
Wow. I have no words to describe Dr. Lee.
She's amazing.
Knowing that there are still doctors that will take the time to figure out somebody's struggle and fix it is comforting. Thank you so much.
Oh, give her a little smooch. Come on. Oh. All right, troublemaker. You stay out of trouble. You keep running the ship.
Thank you.
Bye-bye.
Bye-bye. Happy?
Very happy. Very, very happy.
Can we get out of here now so we can go make out?
Yeah.
Yeah.
We're gonna do something where we give a little vibration here.
You feel
See
it?
your little vibrating right there? Isn't
Do you
that
feel the
awesome?
vibration?
Yeah, you're doing
Focus on the
good.
vibration.
You just stay still, and we'll be done.
Point your brain to that vibration. Do
Oh,
you like
he's
it?
smiling. He likes it.
Do we need to get one of those?
Yeah.
Looks like you do.
I've decided to use a buzzing device. This is like a vibrating wand that I've cooled, and it really introduces another sensation for the patient to think about, and I think it's working.
Okay, we're done.
Hi.
Hello. Oh. Okay, you're not gonna feel it. I'm just gonna take that off, but you're numb, okay?
All right.
So just hang out with me for a moment here. You're gonna do great.
rolled off like a little rock. You're already looking so handsome.
Oh, wow.
I'm gonna go to the other side so she can do the other side of your nose.
Okay.
Almost there. Close those eyes. I don't want to stick my finger in your eye. These are like special serrated scissors, so they can grab a little bit more.
Oh, wow.
Okay, that's it. That's it for that. Let me just, you shouldn't feel this, okay? Just me touching you. Close those eyes again, okay? You okay?
Heck yeah.
Good.
These are the last bumps I'm snipping off. These are the ones that have the highest chance of getting caught on things, of bleeding easily, maybe leading to infection. He doesn't exactly love being cauterized, but he's doing a really good job at staying still.
Let's just show you. Can you hold the mirror? So you see that there are like little spots there, but they're flat. They'll heal up.
Yeah.
There you are.
I wasn't really sure what would happen when we got here, but I'm very relieved. I'm very happy. There will be less bleeding, and I'm not as worried about his infection as I was before. How do you feel about your bumps being gone?
Good.
Yeah?
I feel great.
You feel great. All right.
And here's Mama. Hi, Mama.
We've been through a lot, but Dr. Lee really took time to go slow and work with Jordan. Not all doctors in the past have been as patient. They haven't been as understanding. Dr. Lee is very loving and very caring, and somebody might have a crush on her.
I'm gonna numb Jackie using the tumescent technique. Tumescence can help in the shoulder area because it's really pulling this growth away from important nerves and structures. It can make an area twice the size or more, so I don't want her to really look over her shoulder and freak out and see this bump like the size of her head for real now.
You shouldn't feel anything other than us touching you, okay? You okay? I feel like you can almost take a nap. Take a nap. Take a nap.
No.
Yeah.
I guess Jacqueline's okay because now I just sliced her open and she seems to be pretty calm and chill about this. So thank goodness that relaxing medication worked. Now I just gotta scoop this big bump out of there as quick as I can.
Just removing, there's some like little fibrous bands that are keeping this in place. So I'm just trying to like tease them away gently and safely. It's gonna squeeze you, because sometimes I try to not use anything sharp and try to squeeze things out. Popping it out is much safer because then I'm not gonna shear any vessels or anything.
Right.
So I gotta use my brute strength here.
Okay.
He's coming, he's coming. Come this way. It's just stuck in there.
Yeah.
Come on, little baby. Come on. Come to Mama.
Oh, it's such a weird thing.
This lipoma, it really just keeps coming and coming. I hope I can get this all out before the relaxing medication wears off. Honestly, though, I don't think Jackie's gonna care any which way at this point. I mean, I think she's feeling pretty good.
Last little bit is the underside, and so I'm very gentle with that part because I don't want to pull on you. We want to leave the things that we want to leave there. Just take the lipoma, nothing else. Sorry, dear. There's like one last little bit. I just want to make sure that all this looks clear before I snip that area. All right. Guess what? It's gone.
That was pretty heavy.
Success, the mega bump, gone, out of there. Now my task is to sew up this really long incision and make Jacqueline's arm as pretty as she is.
Done. So let me grab you a mirror, okay? See that arm right there?
Oh my gosh.
Right? This is all fluid.
Wow. Wow, yeah, I'm so excited. I feel like a different person right now. It's almost like you want to go run on top of the buildings and just start hollering and feel like you're not being a freak, you know, like because you're happy.
I know that was really hard for you to get over out of your mind. You know what I mean?
Yeah, I did not feel a thing.
Oh, really?
I didn't feel a thing.
That's great. That's great.
Dr. Lee was able to keep me in a calm state. My fears were really senseless.
Hey, you take care, all right?
Yes, thank you.
Bye-bye.
Now that this lump is gone, I'm a stronger person. I can do what I want and be me.
So you shouldn't feel anything other than us touching you. Pulling down on your eye, okay? Sorry about that.
First, what I do is I debulk the tumor. You might think that that's me just removing the skin cancer, but no, that's me removing the top of the cupcake. Now I need to remove that entire cupcake that is in the mold, but doing it really thinly. I just want to take out the skin cancer, and that's it.
A little buzzing sound you're gonna hear. Just a cautery that stops little baby blood vessels from oozing. Let me process this, so we'll look at it under the microscope. It's gonna take a little bit. I say it's a lot of hurry up and wait.
Okay.
Okay, you did okay though, huh?
Yes, thanks,
Okay.
Dr. Lee.
Wow.
It's really important for me to make a map of this tissue so that I know how it was placed on his skin, so that if an edge happens to still be positive, I can go right back to that specific edge and remove just a little more from that place.
It might wanna easily, break apart there.
Okay.
The next step is to take this tissue to my Mohs technician, Rachel. She's going to freeze it so that it's more solid, so that you can cut through this in very thin slices, so that we can put it on a microscope slide. I'm gonna look at this piece of tissue under the microscope to see whether there's still some cancer that remains.
What I do is when I look under the microscope, I'm checking to make sure I have skin edges, and I can see where my markings are, like the colors of the nicks of the tissue. Now when I'm looking in the microscope, I see some positive edges, and I'm gonna mark that where I see it. So we have to do another layer here.
It looks like there's still some skin cancer cells present, and this always makes me concerned, especially when we're coming up close to its structure, like his eye. There are certain areas that this can progress to, like if this affects his eyelid, then that's really an area that I would refer this to somebody else. So we might not even be able to complete the surgery if it progresses too far.
Okay, just a little bit more from one little edge here, okay?
All right.
Then let me make sure. You okay, yeah? So keep your fingers crossed here. This one looks pretty good.
All right.
I'm feeling better about this round of tissue. Hopefully this will mean that this next round is clear. It certainly was deeper than I expected, and the deeper or the wider that we go, the more complicated this is gonna be.
Those flaps of skin were bigger than I expected her to take off.
Oh my God.
All right. So you're clear.
Got it.
When I look at it in the microscope, I don't see any more skin cancer cells.
Nice.
I'll go ahead, I'm gonna send this to pathology, but we got it.
Big sense of relief after she said she got it.
If I felt like I could exhale, I had been holding my breath the entire time.
And you're almost done. This is our last step here.
The creative part of all of this comes out when we're doing the reconstruction. James has a circular defect here. So if we close this side to side and I pull it this way, that's gonna pull down on your eye. So instead of pulling this up and down, I could really redirect this tissue in this direction. So I'm pulling it closed now, and the tension is now this way, and so now I'm not going to pull down on his eye.
Okay, so let me put a stitch in. It's gonna feel a little tight because we're pulling something from side to side, but we can see here how we've gotten this tissue all ready to pull, and we've got some nice movement there.
I can't believe it's gone.
It's good. You were dealing with that for a while. It's probably something you've thought about all the time.
It only took 3 hours and several Mohs layers, but we finally got him clear, and I'm really pretty pleased with the results. I think he's gonna be really happy as this heals up. And I mean, he's still gonna be able to sleep well at night and close his eyes.
So you can take a look. It's gonna be funny looking and bumpy, okay?
All right, Dr. Lee.
There you go. There you go.
Nice.
After 2.5 years of dealing with this on my face, just real ecstatic to see it gone. It was just unbelievable.
Okay. You okay, right?
I am okay.
Okay, good. Trying to take as little bit as I can. Almost got it all. off. There we go. We've taken it off, but let's take a look at this area now, too.
I'm really happy that I was able to remove the bulk of the really ugly, really noticeable part of Michaela's nevus, but there is still a little part of it that I see here trailing on the side. I don't know whether I'm gonna be able to attack that because the tension on this skin wound is at its highest, and that tension is causing me tension.
Is it looking like you might be able to just pull the skin?
I don't know. Let's just see what we got.
I'm pretty happy that I was successful in removing a good amount of this nevus that she has, but I need to make a decision. I need to decide whether I can try to remove a little bit more, or is this gonna risk maintaining enough laxity in the wound edges to be able to pull this together?
I want to go below the hair follicles so I don't destroy the hair follicles. And I'm also going to the level of the fat because I can more easily loosen that skin underneath there and pull it together. Phew. That looks better. Okay, great. I got enough skin now. This should close up nicely.
So the scalp is pretty tight. For me to be able to close this wound side to side, I have to do something called undermining, which is when you really try to release some of the tissue so that you can take advantage of some of its stretch. And you do this by freeing it up from the skull and go under the hair follicles and really not destroy them so that the hair will still grow. I am not able to remove all of the bumps. I have to leave a smaller row of this nevus or this birthmark to get another day, because I really need the skin to be able to be pulled together side to side, and this does not prevent her from coming back another day once it's healed.
So take a look here, okay? Wow. Yeah, it looks good. So I'm just gonna numb this side first.
I want to remove this big cluster of cysts that Joe has, and I'm gonna start with the one that is lowest, and this is a very vascular area. It's a good strategy for me to remove the lowest one first so that the blood from it, if it's dripping, doesn't drip into other cysts and kind of obscure my vision. Chloe's getting lessons that are not even in the textbook. This is cyst smarts.
Let's do that big mama here first. Did you want to see too?
Yes, I was.
Oh, you do? Look, she's like, before you even finish answering that question. We're really trying to remove the areas that have less hair because it's stretched. You can hear me here moving around. Gonna hear a buzzing sound, but you shouldn't feel anything other than us touching you here, okay?
The bleeding with this big cyst is not as bad as I was expecting, and I do really enjoy popping them out intact. But sometimes when the cyst is older, they are often really stuck to the scalp at a wider base, and I don't like to just cut underneath there blindly. So in this case, I decided to really make an incision and pop some of the contents out. Chloe's lucky because I don't think I learned any of these until I was on the job myself.
It's just got a lot of sludge in it. Cement. Ooh, splash there. Okay, let's do a little scooperoo. Careful there. Okay, under there. That was it. That was the squeeze part. So, Chloe, so you can see the deflated balloon here.
It's like she's taking out a piece of your brain.
Now, let's do that second one there.
I'm moving on to the next closest cyst, and this one is smaller, so in my book, that probably means that it's younger, so hopefully it really hasn't planted its feet into the scalp.
Just pushing against you. That's it, that's all.
It's out. Not fully.
That
but...
was like you having a baby.
Yep.
Oh my
There's your little
gosh.
kidney bean.
The second cyst came out pretty easily, so hopefully I'll be able to move on and get rid of all of his cysts and not have too much of a problem.
So I'm just gonna see whether it's liquid in there actually first, so.
This This is an older cyst, I suspect, and it feels like it's under pressure. If I were to cut this open, it could really make a big old mess. So I'm going to release the cyst. By doing this, I'm showing Chloe a really important lesson: how not to get hit.
Ooh, that looks like brown sludge.
Yeah.
All right. Just beware, you can get squirted here.
This old cyst is doing exactly as I hoped it wouldn't, but kind of expected, bleeding really well from a nice big vessel there. So I really had to take my time and find it. Got to hemostat that and get a good grip on it, because if this takes me a long time, I'm not gonna be able to remove the other cysts.
Let me see, is it oozing under there? Yeah, it wants to ooze on me. Oh my gosh.
I'm trying to remove his oldest cyst here, and this one is proving to be a little bit more of a problem. It likes to bleed a lot. So this is a really good lesson for Chloe, because she can see that not all these cysts are so easy, and some of them are fighters.
I'm just trying to get him without having any oozers too much.
This guy was maybe the worst.
Okay, let's take a look at that whole thing. That's number 3. 10 hours later.
I removed the third cyst, and interestingly, he's got a couple little satellite cysts, and they were hiding under there. I'm gonna use the existing incision and just pop it out from the edge.
It's almost like two giant tonsil stones.
Oh, wow.
Yeah, that's a cute one. And since he's a oozer. All right, they're all gone.
Wow, Chloe really got to see the full range of what we see in cyst removals, especially pilar cysts. You got to see a really perfect one that I had to really fight with, one that was filled with liquid, one that was bleeding a lot. This was really a masterclass in cyst extraction.
Okay, let's take a look at your head.
Well,
It is bumpy.
it's nowhere near as bumpy as it was.
You did great. I'll go ahead, I'm gonna send this to pathology. Make sure we're not hurting you. All right, you're okay? You got a little egg in here. It's like a little quail egg. You okay?
Yes.
Good.
Okay, so after all this drama, here I go removing this perfect little epidermoid cyst on his brow. And Cedric, he seems to be comfortable and he looks great.
It's a little bumpy right now.
Oh, man. Well, I ain't seen it like this in years.
Looking in the mirror for the first time, I can't believe what I'm seeing. I never thought I'd be looking this way again.
So I think you did so well with this. Let's try to get rid of that other bump on you, okay?
Yes, ma'am.
Cedric did really well, so now I'm gonna turn my attention to this big goose egg more on the back of his neck. This is an area that bleeds easily, so I never know what exactly to expect. And because of his condition, I'm always on high alert.
Let's see if we can't take this out nice and simply. Make sure there's nothing sharp. And it's a lipoma.
Okay, so this is a lipoma, not a giant cyst, unfortunately. They can be challenging when they're stuck on or like they're a little bit more stubborn, but hopefully I can pop this out very simply. That will certainly make him happy and it will make me really happy.
See if this thing will ease out of here. Okay, a little squeeze here. I think it's just barely hanging on, huh? Got it. Got a good looking back here, Cedric.
This was a tough journey for Cedric, but he's gonna get to go home bumpless and hopefully with some newfound motivation to really take care of his health.
Hi.
Oh, hi. How you doing? Oh,
wow, Daddy, look.
Yeah.
It looks good.
Yeah, it does. He was such a good patient. Hold this for me.
Oh my God.
It's not even that swollen.
No, man. I ain't looked like this in years.
Like a new man.
I really thank you. I really, from the bottom of my heart.
I mean, you got to thank your daughter, though, too. She's the one that helped this happen.
If it weren't for her, I wouldn't be here.
Right.
Oh.
It's true. You're a lucky man and you're a lucky woman, you know what I mean?
Yeah.
Thank you, Lord, thank you.
You're so welcome.
I'm just really happy, really relieved. He don't have to go through this anymore. He can actually live a regular life now and be normal. And the fact that I was able to do this and help him out, it means a lot to me.
I can't believe it's finally happened.
And it almost felt like it wasn't gonna happen, huh? You came out that first time.
I ran out of all options. I didn't know where to go. Didn't know who to turn to.
Yeah. We're really happy we can help you.
My daughter being here with me is, and words can't explain it. She is so special, so one of a kind. Without her, I wouldn't be here.
I adore you. You're the best. Can I have a hug?
Oh, yes, ma'am. Thank you. I love you. Thank you.
Oh, I love you too. Take care, all right?
Thank you so much, Dr. Lee. Thank you so much, hon.
Thank you.
Of course.
I really appreciate Dr. Lee. She was heaven sent. What she did for me, that's the motivation I need. Now I can see if I can get back to work.
I think it's just make sure I'm not hurting you, okay?
Mm-hmm.
You doing all right, right?
Mm-hmm.
Okay, good. So are we. Just kind of right over it. Just trying to be a little tentative with what we do. It's like a little calcium deposit almost. Maybe a calcified cyst. Every now and then, a cyst ends up being more complicated, and I'm starting to suspect that this might be the case with Juka. It seems to be very intercalated or attached to the surrounding tissue. I'm just gonna squeeze this here for a moment. You know what I think this is? I think this is a pilomatricoma. Dab that again. Am I hurting you by pinching?
No.
Okay, I'm gonna squeeze you a little bit harder here just to see if I can't squeeze this out. This is a pilomatricoma. Looks like a little cat or something on you, actually. It's a pilomatricoma, which is a different kind of cyst, not as commonly seen, but has this sort of cakey, almost like dried up toothpaste, firm, rocky texture or feel. And they're more rare to see, but my whole concern now is being able to detach this without having any big issues. Let's see if I can get this off now. Hold that gauze under there, please. Let me just dab this. Let me take this off real quick here, okay? Get that, hold that gauze under there. Okay, go. We got it out. I'm gonna go ahead and send this to pathology. There's this one little baby blood vessel oozing. Let me get it. Can you get that hook there so you can grab the side back? Of course, this whole thing couldn't be easy. As I feared, there's a pretty feisty blood vessel. In these instances, I have to move really fast because the more blood that comes out of it, the harder it is for me to see. Any false move by myself or any false move from Juka, and I could poke his eye out. Where is this thing? Hold that pressure until I grab my cautery here. There's like one little baby blood vessel that wants to ooze on us. You okay, huh?
Yeah.
Okay, I think I got it. Let me stitch you up. There was a really oozing blood vessel there, but I was able to clamp that off without really damaging any surrounding muscles or nerves, or so it seems. Thankfully, I was able to remove this without any huge incident. And I think I still maintain my perfect Pimple Popper pilomatricoma score.
Oh,
You can't see anything yet. We would give you the special treat of being the first to see him. He hasn't even seen himself, okay?
Mm-hmm. Oh, he back.
Uh-oh,
He
that's
back.
trouble. Trouble's back. Take a look here. It's just a little puffy, as you know, as I've told you.
Wow.
Right?
Yeah.
Much better.
All right, what's next? I feel different. I feel like a new man right now.
Raise your eyebrows up and down. Still works.
It's almost like a juca that I don't even remember before the bump. It affected me more than I ever gave it credit for.
Here's your friend.
Wowzers. Like a little organ.
Can you get another perf for Eric if he wants to hold it?
No, it's all right. You can keep
Oh,
those.
come on. Are you guys close?
Probably keep those gloves.
Here, put this one on.
Gotta do it, bro. You gotta do it.
Okay. It's like cold, right?
Catch, bro.
Hey, bro. No, bro. Oh, it is like cold. Yeah, I'm good.
Okay.
I'm good.
Okay, so I'm gonna cut through it, all right?
All right.
So the white areas there, I think, are a little calcium.
Oh, shoot.
Bone fragments kind of
Wow. It's literally like little teeth in there.
Yeah, almost.
Crazy.
Anyway, let me tell you, you look 100% better, I will say. Think of all the ladies, that could be a deal breaker.
Deals have been broken.
Seriously, yeah.
Right?
Deals have been broken.
I mean, look at him, he looks great.
Now that I got this freak alien out of my eye, I'm definitely excited to get out and step up the social life. I'm absolutely super thankful that I came out here to see Dr. Lee. Amazed. She did a great job. She's an artist. She's awesome. Life-changing experience, and I'm sure it will continue to change. Thank
Stay
you
out
so
of
much.
trouble.
No problem. Nice
See you
meeting
guys.
I want it back.
No, stop it.
I miss it.
Okay, let's start with this cute one here on your butt. I'm just gonna put some numbing here, okay? A little baby pinch here, okay? Baby pinch. Kind of close to the limit of the number we can remove here safely with the numbing medicine we're using.
There is a limited amount of numbing that I can administer to a patient, and it's because if you have too high doses, it can really be toxic to your heart. So these are all things that I need to keep in mind when I numb her up to make sure it's properly numb, but that I don't have an unsafe level of lidocaine.
Okay. You shouldn't feel anything other than us touching you. Let's try to take this off as evenly as we can without it being bumpy or anything. And let's... Oh, I'm sorry.
Oops, maybe not quite enough numbing. Maybe it's a little too dilute.
Numbing here a little bit. Just kind of doing it gingerly, making sure there's nothing under here that I don't want to wield around. Looks good so far. Okay. Sorry, this is the big... Oh, okay. I'm sorry. There's that piece here. Now we want to try to make this as flat as we can. Oh, sorry.
So I've gotten the majority of this NF bump off the surface of the skin, but I can see that there's still some iceberg underneath that skin, and so I need to try to remove this completely so that it doesn't really simply just herniate back out again. I'm not sure whether this dilute solution is helping me be able to get this done because it's just not numb enough.
Okay, the last bit that I'm taking off here.
Ow.
Oh, I'm sorry.
I need to get Talina through this last bit of stitching before I turn her over and address her stomach, but I think in that instance, when I address that, I'm gonna use a higher concentration of numbing.
Okay. That looks nice. Ooh, that's a cute tush, girl. Looks good. Hey, Christy, can I get one like half syringe or full if that's all you have of regular numbing?
The solution that I usually use is more dilute so that I can apply a higher volume of numbing to an area, but this wasn't very successful. So when I address her stomach, I'm gonna use a stronger concentration of numbing. I really hope this works because I want to give her everything that she's hoping for.
All right, so let's start with the bigger one here.
That's next to your belly button.
Here we go, okay? Make sure not hurting. So this one rubs against your pants.
Yeah, because I wear the high-waisted jeans.
Yes, the mom jeans.
Yes.
This one's way easier than that one on your tush.
Well, that one was like 3 times bigger.
So I don't want to jinx myself, but it looks like she's much more comfortable when I'm using the stronger solution to remove these on her stomach. Let's get this one because it rubs up against your bra.
done. All right.
Oh,
sorry.
That hurt worse than my nipples.
Your nipples?
I had my nipples fixed.
I didn't do anything to your nipples, so I don't know. I'm not responsible for that. But I kind of got to think that a nipple piercing is going to feel a lot worse than any of these things that I've done here today. But I wouldn't know. Okay, last one on your side. Alrighty. Make sure that nothing hurts, okay? Must have been that numbing. Guess what? He's gone. Thanks to the numbing gods, we were able to remove all of the bumps that Talina was really concerned with. All I have to do now is stitch her up, and by the grace of the cyst gods, we will all rejoice. Okay. Can you see your tummy here?
Mhm.
Okay, so that looks really good.
Getting this done changes everything for me. I feel relieved the bumps are off me and I don't have to worry about them growing back. Makes me feel more comfortable to wear shorts or be who I am.
And then let's take a look at your tush here. That looks good. It actually falls down really nice, and it's just puffy because you put numbing under it, but I think that's gonna look pretty symmetric.
It's a big deal for me to be a good mom and a good role model. Thanks to Dr. Lee, I'm gonna be the best mom I can be without the bumps. They get the mom they wish they always had. They don't have to walk behind me, they can walk beside me now. They don't have to worry about tucking in my bump. They can be normal kids when they're around me.
Let me take out these first few and just get a feel of everything here. Okay, do you wanna take a look now?
Yes, I'm excited.
Right there, can you see that with my hand there? Okay, that one was oily.
Oh my goodness.
There's another one right next to it. Okay, you can take a look again.
Oh my goodness.
So there's the oil there too.
That is a lot.
The butter, oh, there's more. Where the cluster is. Sometimes these same areas, you gotta come back and do it again because there's other ones. Like almost like a cluster of grapes, like that's what it's like.
Oh, can I see the sack?
Sure.
Very good.
Here, there's a sack. Not very impressive. I mean, you know, you don't have an impressive sack, sorry. Don't be insulted.
I'm good.
Okay. Doing great. And this is gonna be my process for the next several hours. It's a lot of pop and squeeze.
Oh, shoot.
A lot of tweeze and snip the sack. Seal up with skin glue some of these little incisions that we made, or for the bigger ones, stitch them up. Let's see how many of these we can get done. Is this like cathartic? It's better than massage?
I love it. We got a lot, huh?
Some of them have doubles in them.
Mm-hmm.
Look, all these here, right?
God, they just
Right, you think like we're doing such a good job, and we are, but like there's so many
never
hidden.
ending.
Right. I mean, I'm gonna try to get as many as I can.
Take up the whole session, huh? Just that alone.
I mean, there could be like 30 right in here. It starts to shake here because I'm squeezing so hard. Oh, well, there's still so many left. Now it's a race against my hand strength. When I look back and see how many I removed, it doesn't even look like I've removed that much, but it's really double or triple the amount than it appears because they're just layers of steatocystomas under there. This is really taxing, but I really want to try to get as many as I can here. All right, I'm starting to lose my squeeze muscle now. Okay, I'm reaching max capacity. We're getting there.
I just ripped my skin off. Let's just do that.
All right, I'm starting to lose my squeeze muscle now. Okay, I'm reaching max capacity. We're getting there.
I just ripped my skin off. Let's just do that.
But you see this definition now. It's coming out, right?
Yes.
But yes, it's not so easy.
I'm here with Brittany, and I'm tackling these steatocystomas on her chest. I did not expect them to be so densely packed in her upper chest area, and it's taking me a lot longer than I expected, and it's also taking up a lot of my hand strength. So I'm not really sure whether I'm going to be able to proceed and address all the ones that I promised her. That's what's so aggravating about it.
So much better.
But it does, huh? When you look beyond all that, look at that beautiful definition. It is flat, it looks beautiful. Hold on, let me just put a stitch right here. And then I think I'm at max capacity, but I do think that we've done enough.
Great job.
I do think this looks really good. Even though we removed so many of her bumps today, and especially these big clusters that were on her upper chest, I really feel bad that I wasn't able to address all of the ones that she wanted today. The most important is that you can appreciate the change. We did a lot here.
Did.
And we got so much of this down. I hate to leave a job partially undone, but it's out of my hands, really. If she heals up okay, maybe we can do some more in the future. The next time you're gonna be like, can you do these? And I can show the side boob.
Right.
I am extremely thankful for Dr. Lee. Removing these bumps is not easy. I am so happy that Dr. Lee was able to get this amount of work done in such a short amount of time.
I adore you. You're the best.
You're the best.
No, you're the best.
I can actually feel sexy and confident again. And moving forward, I can get them removed. That part right there is just a blessing because I thought that there was nothing I can do. I had no control over it when I do have control. I have all the control in the world.
We're in business, baby.
I'm gonna start on this side. Close your eyes, keep your eyes closed, but let me know if anything hurts. I'm gonna do electrosurgery on John. This is where I use an electric loop. It is really a current that is going through this loop that allows me to cut and cauterize the tissue at the same time, which is key. Cauterizing is a medical term, essentially burning the flesh, really. And here, in these instances, I'm trying to really seal blood vessels and prevent them from bleeding. But in this case, I'm also using the cut function where we're really just trying to surgically excise the area as well. The goal is to really try to remove all this rhinophymatous tissue and leave your normal nose intact. And a lot of times I have to take thin little slices like you would of a gyro, but I'm just trying to remove it evenly because if I take too much, you can regret it. I can't just put it back. This person's gonna have a different shaped nose. And just like a great gyro chef, every piece means something. You okay?
Yeah.
I feel like are you wincing because it really hurts?
Not because it really hurt. I mean, I can feel it, but it's not, it don't really hurt.
Let me see, let me get the edge here. Close those eyes. You okay here?
Yeah.
I already see your nostril opening up.
Oh, really?
Yep, I do. Oh, this is good because I'm taking huge chunks off of John's nose, and this is really gonna help him to breathe better. I just hope that he allows me to keep going. We still have some work to do, and he lets me dig deep here. Courtney, I mean, he looks like he's okay. I was kind of concerned about him. Okay.
He's not a complainer.
Right, he's not a complainer. That's what I'm worried about. You okay? I see that John is getting uncomfortable, and I've used a good amount of numbing. So this is really when I start to have concern about how much numbing solution I'm using and the safety of the patient. I mean, if they have heart conditions, if they are at a more advanced age, these are all things that I consider that really can increase your risk of having problems or complications with numbing solution. If I can't get John completely comfortable, I mean, I'm gonna have to stop. I can't do that to somebody. Does that hurt?
Well, like I said, it's more of a burn than it is a hurt, you know?
A burn is a hurt. I don't know, the numbing's not doing so good on you.
Oh, my Lord.
Oh, I'm sorry. Hold on. Sorry. Okay. We're getting to halfway, okay? I'm gonna go to the other side. You gotta move that hose to the other side without knocking this off the thing. I'm here with John, who has rhinophyma, and I'm trying to remove all the rhinophyma that I can on his nose. I've moved to the other nostril. You know, he is starting to feel uncomfortable, and I'm starting to get concerned about the amount of numbing that I'm giving him, that could cause some heart issues. Hopefully, I'm gonna be able to finish. I think what happens is you have these oil pockets in here, and they get heated up, and so that probably transmits that heat to you.
Yeah.
With rhinophyma, there's not only thickening of the tissue, but there is a lot of oil, a lot of sebum that is built up within these pores. So you can find these big pockets of custard, essentially. I mean, these can be fun and really satisfying to pop, but I do think that this cautery that generates heat can really heat up those little oil pockets and really kind of cause more transfer of pain. I mean, imagine if you stuck a bowl of custard into the microwave and you heat it up. If it touches your skin after that, it's gonna burn. And imagine this is what I'm doing here. I'm heating up this custard or this oil within his nose, and that's probably causing him some discomfort. All right, hold on, there's a little bit of oil in here. Let me see if I can squeeze that out. That makes it smaller already. We're so close. Remember, we've done most of the areas here. I just got to clean them up a little bit, okay?
Okay.
It's like sometimes I don't want to take it too much on one side, because then that means I have to take it that same nut on the other side. I want it to be nice and even. One of the toughest things about rhinophyma surgery is knowing when to quit, because it can look very deceiving right afterwards. It's really swollen, it's really inflamed, it's really red. The patient might also look at it and think, wow, this doesn't look like anything was really done. But it takes some experience doing this procedure and the knowledge that you know that it's more swollen, you know that it's angry, you know that the area is numb and the patient is feeling numb, so it feels like this area is huge. But sometimes it's best to stop, let the healing begin, let the inflammation go down, and then reassess it at that point.
Yeah, it looks great.
It looks pretty good. No, I see the potential because it's all swollen right now. So you can turn that off. How you doing?
I'm doing good.
That was pretty
How
bad
about
though,
you?
huh?
No, it wasn't that bad. Really wasn't.
Let me sit you up so you can breathe a little better first. Well, that was a tricky procedure, but John really powered through that, even despite this sort of feeling of hot custard just dripping from your nose, really. So hopefully we'll get him back to that dashing man that we see of yesteryear. His nose is so tight right now because we got so much numbing in it.
Good.
But you see it, right? His nose is coming back.
It's a huge difference.
So I'm gonna show you the prosciutto we took off, the bacon bits.
Wow.
See the cheese that kind of came out of there too?
Oh my God.
You see that?
Yep.
That was a tough one, I will tell you. You did really good. It's gonna still look funny right now. It's still super swollen. Hold this mirror. Can you see it or do you need your glasses?
No, I can see it. Oh my God, it's ugly.
Yes, it is, but it's prettier than it was before.
Yeah. When Dr. Lee finished with the surgery and brought the mirror and showed me my nose, the first thing went to my mind was, holy but it's, my hoping is it looks perfect, which I think it will when it heals. I appreciate you very much,
You did awesome. It's gonna look really great.
John is the reason that I do what I do. And after years of searching for a doctor for his rhinophyma, I think I found the best person that could perform that procedure for John.
All right, we'll put a nice bandage on you.
Thank you.
And I know your nose still looks big, but it's coming down.
That's fine.
I'm very excited about my future. My hopes are when my nose heals, I'll look like I did 20 years ago, look like the old John. Old John knows old man's face.
My biggest concern with this lipoma is its size and the hardness to this. I am going to use the tumescent numbing technique because I do think that that's gonna allow me to properly numb this larger area, but also it's gonna help to pull away this growth and this boniness away from his regular tissue.
Yeah, hopefully this will be the last time I see it.
Okay. Kind of changing the direction of this a little bit just because I think this will make it better for me to avoid that kind of bigger vein there. I use a lot of my fingers actually because it helps me to feel where this is, but also doesn't traumatize the tissue.
Don't let it roll on the floor.
Yeah, it's 5-second rule. If it goes on the floor, it's
Yeah,
okay.
right. 5-second rule.
Still good. Oh my gosh. Look, that is ready
It's so heavy, it doesn't want to lift up. I
Doesn't
have to
wanna
like
go.
put my fingers on it like a bowling ball.
Wow. Get a strike.
Here's that hard part. I can feel it.
Does it look different than the rest of it?
There's like layers of it looks like.
Really? Huh.
Okay, hold on. Okay, now, how do I get this off here? This is like where all its blood supply is coming from.
Well, that was good while it lasted. I was able to get out the really bony area and the lipoma, but underneath I see just a maze of larger veins and vessels. I have to really be precise and make sure that none of these vessels under here are bleeding, because once we sew them up, if this area starts bleeding again, that can cause a lot of trouble. Okay.
Okay, so if I remove this, that should conceivably not lose it. It might lose a little bit just because of this little blood right there. Okay, but let's see. We're getting it there. We made some headway right there.
Nice.
Guess what? He's gone.
How heavy do you think that is?
Maybe 5 pounds.
That's it?
I don't know. Maybe
Not
maybe
impressive.
more. But it's like it's deceiving sometimes. I feel like it doesn't even fit in the tray.
So I was able to buzz all those deeper blood vessels underneath. So this should really heal up nicely. And hopefully I've helped Mike to close a chapter in his life so that he can start a whole new one.
You want to hold that mirror here?
Oh, yeah.
See? You can't really see behind you.
Oh, yeah. Look at that. Wow, that looks amazing.
It was such a relief. You know, all these years I've carried it, now it's not here, it's there.
So, you ready?
Oh my God, look at that.
Yeah.
It looks bigger than it, wow.
So Dr. Lee pulls it out and it looks like a meaty loaf of bread.
I won't drop it.
I won't.
Okay.
All right, here it goes.
Because we're freaks. And 5 pounds.
5.38.
That's pretty good. That's a baby.
Yeah.
I feel amazing. I feel 5.4 pounds lighter. And I can lose even more weight because now I have the ability to exercise a lot more.
Okay, take care, all right? We'll see you again soon.
All right.
Thank you.
Given my religion, there was a part of me that thought, you know, I would never get rid of it, but now that I've made that progress, it's a great feeling to change, to evolve yourself. You know, I'm moving towards the person that I'm supposed to be.
You gonna numb me up good, right?
I bet, of course I will.
All right.
Do you remember a Mr. Babcock?
Yep.
Mr. Babcock was my homeroom teacher.
Yep. Remember Mr. Yamamoto?
Yes, science.
Yep.
It's really wild to meet somebody randomly that shares a lot of the same memories that you have from way back. It's really taking me back.
Do you know the house that has like the turret, like it looks kind of like a castle? It has like a
Yep.
rock. That's my house. That's where I grew up.
Really?
Yeah, you
I
like
spent my
lived-
whole childhood.
Oh my God, we were just
Up in
hanging
there.
out right
Yep,
next
right
to each
there.
other. And then remember there was a monkey on baseline? Remember you drive down going towards Claremont
yeah.
and there was a monkey
Yep.
in a cage?
While we've been chatting, I've been really numbing up the area very well because I do know that because this has been traumatized and there's potentially scar tissue there, that can really be more difficult to numb up. And I really need to numb this up well because there's probably gonna be a lot of scraping going on.
Okay, so let's see here. You have a lot of stuff inside there. Not hurting you, right?
No.
That wasn't a really convincing. No, your
No,
voice got a
I'm
little
all right.
higher. We're just trying to clean up this little mess you made here first. Let's see, it's all like in kind of dried up pieces here. So I'm just gonna tug on you a little bit. You shouldn't. Let me see if I could just squeeze it a little bit here. You like stored a bunch of stuff in here. Christy, I need like a big curette, something that's gonna scratch it a little bit.
Right away, I can tell that this cyst is gonna be a tough one. I mean, I have to really scrape a lot of these contents out, and even the surface of the skin is really damaged. It's thin, it's friable, and I think that a lot of that skin is at a loss. I'm gonna have to really remove a lot of that.
Ow.
Am I pinching you?
Yeah.
I'm sorry.
I want to like
What?
pulling off a scab or something.
It is. It's pretty stuck on you. I gotta like work on it a little, figure out my angle here. Oh, sorry.
Ow.
Oh, gosh.
That one you got.
I am so sorry.
Uh-huh.
The scar tissue that's present is really making it difficult for me to numb this up properly because you really can't get a lot of liquid in something that is really tightly packed.
I don't usually pinch people like this. I couldn't get the numbing right there, sorry.
Ow.
And take out all this material underneath here that has cyst in it, and then try to make sure it sticks back together so you don't have a whole like little bird bath up here for people. Almost flipped some of your cyst on me. Nasty.
You wouldn't be the first person.
Yeah? Who else has flipped it?
I'm scraping off some of the cyst pieces, and it's kind of like crumbled concrete that you're trying to scrape off. You know, I think I'm making progress here, but it's really hard to figure out if I'm getting it all or not.
This is a tough one, actually. Let me tell you, this has a higher chance of coming back because of the fact that it's kind of all like scarred down and damaged there. I'm just kind of, I know this sounds gross, but scraping it all out of there.
Oh, yeah.
You knew that, huh?
Exactly.
Okay, I think I got out as much of this cyst as I could. Because it was coming out in fragments, I think there's a higher chance of recurrence here. I do think that Shad's gonna be pretty pleased with what we've done here. I think it's gonna look a lot better than it did. I mean, I gotta make sure that I do a good job here because Shad knows where I live.
All right, here's some parts of it because it was all peeling out and it all came out in pieces. Look at it.
Oh.
So you can feel back here. It'll be a little bumpy.
Yeah.
After 10 years, my Chad is gone. Oh, I feel fantastic. Dr. Lee did an amazing job.
I got a hat for you.
Okay, perfect.
At least something, right?
Yeah.
That's when you can get all dirty.
Dr. Lee, I'm very grateful for you taking your time out to take care of my bump on my head. In all seriousness, I know we joked around a lot. Thank you very much.
I think I need a picture of you like that. Smile.
Not too bad for a couple kids from Upland.
Just gonna wiggle you here a little bit, and you might feel one little bit pinch. This is the thinnest skin on the whole body, so very, very difficult to get just above it.
I can tell that Ebony does not like this. So I definitely have to keep that in mind as I'm proceeding here.
That's it, just like that. That should be the worst of it, okay?
Now it's my turn to really try to take these out completely, and they're really evasive. It's like, you know, when you pop balloons and then you have to try to find all the little pieces on the floor. And it's really important to try to remove every little shred of that balloon or that cyst to be able to make sure it doesn't come back.
The last time you did it, did you feel a lot of it?
It was traumatizing.
Oh, I'm sorry. Well, I don't want it to be traumatizing this time. Okay, I'm gonna just use 2 Q-tips and try to see if I can squeeze it now. Nope, I still can't, not yet.
You know, my favorite cysts to pop are the pilar cysts that just pop out whole, like a nice little garbanzo bean or an olive. These are really difficult. They're not satisfying to remove because you are never really sure that you get it all. It's such a small little cyst that's filled with water. There's not even any color to it. And then you have this really flimsy cyst wall that just disappears once you pop it.
See how it's like a milky liquid almost? Yeah. There's multiple little loculations, so that is also what makes it a little difficult to remove.
I am quickly discovering that there is a cluster of hydrocystomas hiding behind that one on top. It's like baby clusters of grapes. This is as challenging as a giant lipoma. Plus, every time I try to do something, I feel like she's on the edge of flinching.
And a little buzzing noise here, like that. You okay?
I'm cauterizing what I think is the root of this cluster in the hopes that it will seal this off and that these won't reform again. But you know what? It's difficult in this really small space to be able to see exactly what you're cauterizing, so it is something that you have to really hold still for.
Okay, sorry. Let's try to get those other 2 here. Okay, sorry. Pinch,
It
huh?
like burned a little bit.
Okay, I'm sorry.
Ebony is absolutely uncomfortable. I mean, this is a really difficult process, but I do feel like neither of us wants to give up yet. So it's really a tightrope walk, me being able to get as many as I can with her remaining comfortable. Okay.
Are you all right?
Yes, I'm okay. I think that one pinched a little more.
Yes, it's kind of frightening. Seeing the scaffold close to her eyeball. Anything make your wife uncomfortable hurts real bad.
That little one hurt.
I'm sorry.
Now it's come to this point where every little move that I make, every little numbing, every little cautery, every little poke with the blade makes her flinch. So we might not even be able to complete the surgery.
Dang it. Let's see if we can't do some kind of measures that are gonna make this better. And let's see if I can't find someone, like an eye doctor that specializes in these more so. Because I do think you're gonna need multiple treatments.
I don't think she can tolerate it anymore. So I think now is the time to quit. She's really uncomfortable here, and there's some really tough corners like the medial canthus, the lateral canthus to really get to. Maybe she would consider doing this under general anesthesia. And I'm really gonna try to find a great oculoplastic surgeon or ophthalmologist in her area who can really take care of more of these. But let's wrap up what we have going on here.
Okay, that does look a lot better.
You look a lot better.
Yeah.
She got to be
Presentable now.
Yes.
I do think we did some good work today. I think I was able to tackle Ebony's most prominent hydrocystomas, and I'm really excited to show her her results.
Take a look and see.
Oh my.
Yeah?
Yes. Thank you so much. This is life-changing for me because when I look at myself, I don't see them big bumps. So I'm happy. I'm very happy.
I think that what you should do is oculoplastics, or somebody that specializes in the eye will have the right equipment to get the other little ones. We'll try to find you somebody that's really nice and gentle.
Okay, thank you so much.
Okay? Yeah. So cute. Oh, I adore you. Thank you.
Dr. Lee is so informative. I now have a better understanding of my condition.
She's gonna leave the shades behind.
I'm not gonna wear my sunglasses inside no more, but they still cute. When I go to the beach, I still put them on.
You might just feel me putting a little baby pinch on your skin here, just a little baby pinch. How was that? Was that terrible?
No.
I heard you screaming on the inside. You doing okay?
I'm numbing up Ralph's back really well to make sure that I can remove probably about 5 cysts. I'm gonna start with the Bermuda Triangle, and after that, time permitting, I'm gonna jump on some of these blackheads.
Make sure I'm not hurting you, like I said. Are you ready for a squeeze?
Yes.
You wanna stand up for that one?
Yes, please.
You got a little hard-boiled egg in here.
Really?
There's that golden cheese.
Oh.
It's like dried cheese. Cream cheese has been sitting in the fridge too long.
That's a description. Okay, I'm gonna loosen this sac wall from here. If I'm pulling or anything pinches, you tell me, okay? Trying to loosen it. There's scar tissue here. I try to get the whole sac out intact because that'll tell me that I got it all, right? Oh, scar tissue here. 1 down, 1,000,000 to go.
All right.
How many times do you think it's been inflamed before?
I gave up counting.
I'm gonna squeeze you again, okay?
Okay.
It's been stuck in here for a while. What do you want me to do?
That was a good one.
It's kind of dried up and crusty.
Yeah.
Oh, wow.
That's a lot of me is dried up and crusty.
That's what I wasn't gonna say that. You said it for me. They're so hard to kind of work at. We're just on our second one, so.
His back could keep you busy for a while, couldn't it?
And then number 3, the other hard one. Let's see how that one goes. Let's see. I think that one's gonna have some scars in it too. I'm gonna squeeze. Hopefully those other 2 are smaller and may be more agreeable. See, it's like burrowing down into this area right here. All right, I need you to lean a little more forward. Is it like uncomfortable for you? You want me to get you a little stretch a little bit?
It's the shoulder.
You want to lie down on your tummy all the way?
Well, we can try that, sure.
Ralph has done great so far, but I really need Ralph to roll over so that I can get better access, a better angle to remove this last cyst. But this might be where I push him too far.
Oh, there you go. Oh, you okay? Can you lower this here? Thank you. Getting pretty tired?
No, I have to pee.
Oh, you have to pee. Okay, let me just quickly put a little stitch in here.
Okay, so Ralph has to pee.
Yeah, your feet are gonna come right down. There you go, there's your foot.
There you go.
This is a long procedure, so of course I understand if he has to take a little bit of a break. So I'm gonna send him to the bathroom, and when he comes back, we'll see how he's managing things.
Careful. I'll be right here if you need me, okay?
All righty.
Because Ralph is older and diabetic, it is really important that he has enough energy to endure this, that he has enough food and water in his system.
We gotta get some food in you, okay?
Maybe while he's doing this, it's a great opportunity for me to work on some of these less invasive blackheads on his back.
Now, let me get a couple of the blackheads, I guess, while you're here.
Oh, that was a good one.
Hey, look how much it extends right there.
It's amazing how deep they go.
You okay? You're kind of trembling. Are you cold?
A little bit. That's partly because I'm just recovering from lying on my stomach.
I didn't realize that Ralph is shivering. Obviously, his body is giving me cues that he's still out of sorts.
I'm gonna make a little executive decision here. I mean, you're shivering here a little, you're tired and you're tough. I know that, but you know what I mean?
Yeah.
It's been a really long day for Ralph. He's been tough. It's been a long journey for him. But I think it's time to make that call.
You're tough, you don't want to admit it, but you've had enough, I think. And I know you're gonna deny that, but your daughter's here with me and it's 2 against 1.
She didn't stop because he was tired. She stopped because she didn't want to put him through any more stress because he was getting the shakes. He's a diabetic.
And she's very meticulous in her actions and very honest in her approach. I can't say enough nice things about her.
So your back looks really good.
Oh, okay. Oh.
See from the side here? Those bumps are gone. They're nice and flat, right? Okay. We got a lot of those cute little blackheads right there.
Cute, yes, aren't they?
Aren't they adorable?
I've been fiddling with these things for about 30 years, and finally, I feel so relieved and so happy that we came down here and had this done. When she says it doesn't hurt, it doesn't hurt.
Just a little tightness, maybe. This is the numbing going in.
Any growth that is large, there are more things that I have to watch out for. One is bleeding and protecting deeper structures. This is why I'm gonna use a tumescent technique here. This allows me to really infuse saline in there with the numbing solution and allow this to pull away from deeper structures while also helping with bleeding. But also, if there's a very noticeable superficial dilated vein, I kind of try to trace over it. It helps me a little bit, especially when you hit it and it bleeds a little bit more in that area, you know that it's that vein and not to worry about it so much because you can control that bleeding. I really hope this works because I want to give her everything that she's hoping for.
All right, so let me just take a little peek and see what we have here, see what this is.
Oh, I hope it's lipoma and not a cyst.
Oh, you do? Me too. Okay. Right here, we took a little peek, about 1 inch exposure, and it looks like a lipoma.
Okay.
And it looks like it's ready to pop.
The good news is that this seems to be a pretty nice, benign-looking, smooth lipoma. I'm gonna just try to start removing it, and maybe this is gonna be a lot easier than I thought.
Let's see if I can squeeze it out. I got half of them. Let's see if I can convince the rest to join it. It's kind of stuck right here, that's all. I think this is the oldest part of it, maybe. So I'm just gently trying to tug him loose.
Okay, I guess I spoke too soon because the oldest part of it, or what I perceive to be the oldest part, is really kind of twisted and wound down onto her shoulder. And I could see that it sort of has these lipoma arms that have it's almost like they've reached out and they've gripped her shoulder to hold on, making it very difficult for me to remove this. I think we can pretty much forget a nice clean pop at this point. I just hope that I can get all of it.
Such a troubled child right here. Dang it. Yeah, let me just try to trim this away because it's just taking us a long time to fiddle with that and I can't see that well. Ready to catch it here? All right, we got most of it off. There's still a little bit here, but because there's one little slowish oozing vessel that I need to tie off. It's just a little vein, because you can see it compresses. See, there's a valve, watch, when I go like this. And it's a valve right here because it flushes back in.
I've removed the smooth part of the lipoma, the top of the lipoma, so I could really see what's going on underneath here. It's like you working on a car and you lift up the hood to be able to see what all these other mechanical things are that go on underneath the hood there. And one of the things I'm having trouble with is there's a pretty dilated vein here that just really wants to ooze, and that can be a big problem. You don't want there to be bleeding under this once you close it up because you can get a large hematoma or sometimes it just won't stop bleeding at all. And so it's important that I tie this vein off.
Oh, I think that's gonna be okay.
Now that I've handled this vein, I can just move around with my blunt fingers and really try to pull out the rest of this mushy lipoma fingers that are extending towards the shoulder joint. Okay, let's do it.
Let's get this last little bit here. Woo, okay.
I was able to wrench every last piece of that lipoma out, and I was really able to avoid that pretty threatening dilated vein on the surface. So I feel pretty good about this. Time to stitch Kelly up.
Do you want to feel how flat it is?
Yeah.
With your hand?
Oh my gosh, it's gone.
Yes. So I'm gonna put one little baby pinch here, just on the
Okay.
surface here. How many years would you say you've had it here then?
About 45 years.
Girl, you look good.
Thank you.
I hope this was in the anti-aging button.
I've numbed up Erica really well, and I'm gonna be very gentle here and just make a very superficial, simple incision. And I'm just expecting maybe a little bit of blood here.
So I'm just gonna make a little nick in the skin, okay? You shouldn't feel, I'm gonna test it.
Okay.
Let's see what we have here. You okay, yeah?
I am. I don't feel anything.
Huh, this is weird.
Look at that little blue color right there.
Oh, wow.
It's like paint.
That's incredible.
This is definitely not blood. I've never seen blood this color. I don't really know exactly what's going on here, but it's definitely a weird gray, kind of muddy look to it. So I am not sure what is going on in Erica's hand.
I think there might be a little bit more.
Oh.
What in the world is that?
So fascinating. Look how much more is still in there.
Oh my gosh.
Yeah.
What the heck is that?
So fascinating though. See how it's stained? I feel like it's like dissolved graphite. Look.
That's unbelievable, Dr. Lee.
Wow. That's a whole nother person in your hand.
More and more of these oily black drops come out of this area, along with a lump of tissue that is stained this color. So now I'm thinking that perhaps there was pencil lead in this area, and the body sort of walled this off because it's a little foreign body reaction. I have never seen this in my entire life.
I feel like this is still something here too. I just need to get my bearings and see what the heck is going on under here.
Gotta be kidding me.
Oh, man.
Look.
Oh, she got it.
Yeah. This is definitely the lead. That is just
Unbelievable.
crazy to see.
Unbelievable.
That's the tissue that walled it off, that was stained that.
That was a cocoon.
A little splinter almost of the pen. Oh, that's like the wood.
Yeah.
Okay, well, now I've seen it all. I mean, this is crazy talk. This is crazy stuff. I mean, what's going on here? How could she have pencil lead that is stuck in her palm for the last 45 years? And her body has sort of walled off and protected this portion of her hand just to make sure that, you know, we don't have any problems with that area. Kind of walled it off and put it in its little place like it was in solitary confinement right there in her palm. And now we've unearthed it. A pencil lead. You see the taper. You see that it was probably recently sharpened. This is one for the books. One for the books.
Oh my goodness.
All of that was in your hand.
That's
girl.
unbelievable. 45 years of having a foreign object in your hand and now it's out. Amazing is the word for the day.
I'm a little sad. My girlfriend is gone.
Okay, little baby pinch here. Okay, little baby pinch. So the scalp likes to sometimes just ooze a little bit more because there's so much good vasculature there supplying her what's underneath there and her hair and all this kind of stuff. Let us know if you feel, you know, anything
Okay.
lightheaded.
Oh, I
don't
absolutely
like
will.
Yeah, I don't like to have more than one patient at a time. You'll feel me pushing on you. That's all normal, okay?
Okay.
You doing, and you can kind of hear me, sorry. That's why I jabber away, because hair follicles make noises, sort of.
Yeah,
They talk to us.
I'm seeing her run the scalpel along his bump. I'm feeling nervous because based on what I'm seeing, it looks scary.
Hold this gauze underneath there. You're gonna also hear a buzzing noise. No shock, okay, good. You're doing great. Let me see what we have here. We're just right on top of it. Just take my time in the beginning just to make sure everything looks good and try to keep it out nice and cleanly that I can see and just kind of a little meticulous in the beginning. Right there, thank you, because it was just pulling too much on this side. Let me try to see.
It's really hard for me to find where this blood is coming out from this blood vessel, and I really might have to extend the length of the wound to be able to really properly see into this deep area. I also hear Tania behind me, who is having a tough time watching this procedure. I need to make sure she doesn't become a patient too.
Annoying little baby vessels, just not making it easy for me to see over here. Okay, can you do this for me here then? I can't seem to see it here, thank you. It's like you're having a little baby. You could say you had your first baby together. Are you guys practicing, you said?
Oh, yeah. We're having a baby in April.
Oh, you are?
Yeah.
Congratulations.
Thank you.
She's giggling.
Okay, I calmed Tania down, and so now I can really kind of address this bloody lipoma.
I think I have a clamp over it. Let me see if I can tie that. Got a little pest of a vessel there, a little one. You doing okay?
I'm still in awe of what I'm looking at.
Oh,
When I
really? You can look at it though, huh?
I
It's
can
okay.
look at it,
Okay,
so
good.
that's nice.
We're good there. You can let go of that side. It's fine.
Well, I've successfully tied off this really annoying blood vessel. Now I can try to work on removing this lipoma.
I'm gonna squeeze you here, okay? Let's see if this comes out.
I think this is the part I probably shouldn't watch.
Oh yeah, you don't have to watch it. You okay?
Just the pulling.
Yeah, just it's pinching. I got a really good pinch muscle. It's like having a baby. I think he's gonna be better at having babies than you. Might not be that easy with you.
Oh my gosh, that's very interesting to see.
Yeah, we're
That's
almost
so
got
cool.
it.
That's crazy. It's really cool, Michael.
Guess what? It's out. You had a little baby girl.
This one I don't want to take home though.
Oh, we'll send him home. Let's put some stitches there.
Even though that blood vessel gave me some initial kind of pause or some trouble, we were able to get this out in one piece. Mike and Tania did really well. I'm really proud of them. And I'm really proud of myself because I got to deliver their first baby.
Oh my God, that's
It's
crazy.
like a little brain.
Yeah,
Right?
that's,
Isn't that crazy?
that's so weird.
Here's a mirror. And you can kind of, but I'll also show you a mirror so
wow.
you can see it.
That's crazy.
Right? You can kind of see that.
I feel good. I feel happy. It's crazy. It's not there anymore. It's literally a weight off my head knowing that this is just a lipoma, and I could have and should have dealt with this a long time ago.
I'm really proud of you. Thank you so guys. Congratulations.
Thank you.
I'm glad I was like the first delivery on your side, right?
Thank you.
You guys take care and congrats.
Thank you so
okay?
much. Thank you. I'm so happy. I know that he's gonna feel much more confident at our wedding now, and I'm also looking forward to our photos because that's a really big deal to me.
Now I don't have to wear a hat.
I know, now you don't have to wear a hat to our wedding.
Yeah, serious. I'm not gonna throw all my hats away, but I won't wear one at the wedding.
Fair enough.
Baby pinch. You okay right there? Did you feel that? Oh, okay.
During the surgery, if I tend to pull or cauterize a particular area, if that elicits more pain, it could be that has some connection to some deeper structure that is really kind of causing discomfort. And I don't want to do something that causes permanent and consistent pain in that area.
So like I said, make sure nothing hurts, okay?
Oh yeah, I felt that right there.
I'm sorry. Right there on that edge, huh? Okay.
Plexiform neurofibromas have a distinct sort of appearance. When you lay them flat, they just kind of flatten out. I mean, I don't know what I'm gonna see under there. I'm gonna just be really as cautious as I can, try to go really circumscribe this area with my blade, and let's see what we can take off.
It's just kind of like a challenge because when I lay flat, it like lays flat. And so I want to lift it up but not take off too much. So I'm just trying to find the right angle to do this. It's like removing like eyelid skin. It's very flimsy and moves around a lot. It's like a giant piece of eyelid skin.
Grabbing something like this is like grabbing a rotten peach that, you grab it and the skin kind of almost falls away from it. Meanwhile, I'm trying to keep Amanda as calm as possible while I'm removing this, and this growth is just not cooperating.
Buzzing again.
Ooh, I feel that a lot.
I'm sorry. A lot? I'm
Yeah.
sorry. I'm sorry.
I can't get a good grip on this loose skin. It keeps trying to get away. I don't want to cut too deep because I don't want to go and probe for any of these neurofibroma cells that might be wrapped around important structures down deep.
You okay, huh? Okay. Just let me know again. Yeah, you okay? You okay?
Yeah.
Got it off. Okay, let's put some stitches in now. It looks pretty flat right there, but we got to be able to pull that together.
So I got the part off that was hanging, but not disrupting any deeper components. And I think, that will make Amanda really happy. Now is the time to stitch this up, and hopefully this will relieve a lot of Amanda's symptoms.
Everything looks good. As I've told you, I can't get around this whole thing. That's too large of an area. So we're making it flat, and then hopefully that's gonna help to diminish the discomfort. Okay, did you wanna see your neurofibroma on the tray?
Oh, definitely.
It looks like a hamburger patty.
Oh wow, it does. That's crazy. It didn't even look like that on my back.
Take a look at the undersurface there too.
Oh wow.
So see that middle, the yellow part, that's like fat, but see all the edges,
Yeah.
how it's sort of clearish? That's more neurofibroma, you know?
I never would have thought it looked like that.
Looks like when you peel up pizza.
That's
Cheese
insane.
pizza.
I've been told by so many doctors this can't be done over and over again that it made me lose a lot of faith that this was ever gonna happen. I'm just really, really happy that it finally did. I'm really happy that Dr. Lee was able to help me. I really wanna go back to the previous doctors, all of them, and say, look, you were wrong. It could be done, and it was done.
Did you wanna see it?
Yeah, let's take a look with you.
Oh yeah, a lot better.
Yes, a
Thank
lot
you.
better. Okay?
Looks like a different back.
Yes, it looks like a regular back.
Yeah, thank you.
I really feel like this has changed my life for the better, so I can just be myself again, just be happy again, and hopefully be pain-free.
I think it looks really good. I'm pretty pleased with that, and we'll see about the pain. I hope it helps that. Okay, but you did great. You're
Well,
such
thank
a
you
pro.
so much.
Thank you. You're such a sweetheart.
I'm really looking forward to Tyler seeing like the old me, maybe seeing how confident I used to be and outgoing that I used to be. I really want to give Dr. Lee a big hug and just tell her how much this means to me. I don't think she knows how big this really is.